In this brief video, I want to talk to you a little bit about the DSM-5, that is the Diagnostic and Statistical Manual, 5th edition. But mainly, I want to reserve my comments in this video about some of the problems and controversies that have come out of this particular publication. There have been a number of them. And so while there are many really good things about the DSM-5, what I want to deal with specifically in this video is some of the criticism that has come about since the publication of the DSM-5 in the spring of 2013. Now, this is a very important subject because the DSM, that is the Diagnostic and Statistical Manual of Mental Disorders, defines for us here in America the difference between normal and abnormal. It helps us to understand what a mental disorder is, and it tells us what mentally normal is and what mentally abnormal is. It tells us such things as when treatment is required and who's going to be paying for it, what insurance companies will pay for, because it is a coded diagnostic manual. It also talks to us about disability benefits. It will decide who will get the disability benefits, that is, and who will be eligible for special treatment in public schools, who will be awarded damages in a particular lawsuit, who will qualify for life insurance, who will be able to adopt a child, and much, much more. So you can just see from this list of things how incredibly important the DSM actually is. Well, there are numerous controversies associated with the publication of the DSM-5. I'm going to talk very briefly about 5 of these controversies: secrecy, false epidemics, biological testing, and overuse of pharmaceuticals, and imprecise diagnoses. The first one that I want to talk about is secrecy. This publication, this 5th edition of the DSM, was produced primarily in secret. In fact, task force members had to sign a non-disclosure agreement. Instead of opening up their research to the light of day where other people could have input, it was more of a closed session, says Robert Spitzer. Spitzer also says transparency is necessary if the document is to have any credibility. The second problem is what some have come to call false epidemics. The psychiatric profession in England has had particular problems with the publication of the DSM-5, and Dr. Peter Kinderman, the University of Liverpool, says there are large numbers of diagnostic thresholds that have been lowered, which means more people will be eligible for diagnosis, thus eligible for psychiatric drugs, for particular financial benefits, hospitalization, etc. In fact, he goes on to say some of the more, what he would consider to be ridiculous, new mental disorders that have been created in the DSM-5. One is the DMDD, the disruptive mood dysregulation disorder, which really amounts basically to a child's temper tantrum. And he talks about the CGD, or the complicated grief disorder, which means if you have a loved one who dies and you go into an extended period of grieving, you may well have a mental disorder. And so by lowering the thresholds of what constitutes a mental disorder, what you end up with is more people having these disorders. And whether it's things like a mild neurocognitive disorder, or an intermittent explosive disorder, or a disruptive mood dysregulation disorder, what you've got is a thing called diagnostic inflation. That is, more things being diagnosed as abnormal and as a mental disorder, and it brings about excessive diagnosis, and in the long run hurts patients. With these false epidemics, as Kinderman has said about the DMDD, that's broadly translatable, he says, into having temper tantrums. What 3-year-old do you know that hasn't had DMDD at some point in his or her 3 short years of life? Kinderman also goes on to say about MND, that is mild neurocognitive disorder, is tantamount to targeting seniors for being forgetful. Well, I guess there have been plenty of times in my life when I could have successfully been diagnosed with MND. Dr. Alan Francis then calls this, in his book, Saving Normal, he says those who are desperately needing psychiatric help are often neglected while the bulk of treatment goes to the worried well. So you can see when psychiatrists are dealing primarily with diagnosing and prescribing pharmaceutical drugs for people who are grieving or children who are throwing temper tantrums, there are obviously going to be people out there who just aren't being treated. Dr. Francis is one of my favorite authors in this field. He's a professor emeritus at Duke University, and he, by the way, was the chairman of the DSM-4 task force. And he talks about the fact that the clearest evidence that supports the disappointing fact of the problems with the DSM-5 is that not even one biological test was ready for inclusion in the criteria sets for the 5th edition. Not even one. So what does this mean? Dr. Francis says it means that it lacks validity, and unlike our diagnoses or definitions, for example, of ischemic heart disease or lymphoma or AIDS, the DSM diagnoses are based on a consensus about clusters of clinical symptoms and not really any objective laboratory measure. At least that's according to the National Institute of Mental Health. And so consequently, what happens is drugs become the answer, and no longer are we dealing so much with issues of psychotherapy as we are dealing with issues of pharmacotherapy. The history of psychiatry is filled with silly and sometimes dangerous fads in diagnosis and in treatment. For example, childhood bipolar disorder used to be very rare, but has recently become so common in our society. In just 15 years, the rates of childhood bipolar disorder have increased by 40-fold. Think about that. But also think about the fact that this has been accompanied by a remarkable increase in the prescription of antipsychotic and mood drugs. So who is really benefiting from this? Well, one of the great beneficiaries is these large pharmaceutical companies. Drugs are the answer? Let's think about that just a minute. And I'm sure there are many cases when drugs have been very helpful, but an overuse of it can be critically painful and disastrous for many patients. The illusion that children's behavior problems can be cured with drugs really prevents us as a society from seeking the more complex solutions that are really necessary. And drugs get everybody off the hook. The politicians, the scientists, the teachers, the parents. Just give them the drugs. Well, it gets everybody off of the hook except for the children, of course. The fifth and the final controversy here is over what Dr. Francis calls imprecise diagnoses. And while he gives several examples in his book, Saving Normal, one of the clearest examples that he gives is that of post-traumatic stress disorder. And in the DSM-5, PTSD is primarily diagnosed on the self-reporting of an individual. Now, would you think about that for just a minute, please? Obviously, many of our heroic military men and women who have returned from these horrific wars have seen nightmarish things that have gone on the battlefield, in the war zones, terrible things, and obviously many of them come back with PTSD. But PTSD is not just a diagnosis for military men and women who have come back. And if it's just diagnosed on the self-reporting of the patient or the client himself or herself, and when it's tied to financial benefits and insurance payments and disability payments, well, enough said. I think that you can see here where the confusion and the potential catastrophe can be. Well, let me just conclude this. There are many other things that are involved here that could be talked about in terms of critiquing the DSM-5. But one thing that I want to mention, if you want to do further reading in this, I would recommend to you the book Saving Normal: An Insider Revolt Against Out-of-Control Psychiatric Diagnosis. This is a book written by Dr. Alan Francis. And what I like about this, Dr. Francis is not just a psychiatrist. He was one of the men who was in charge of the production and publication of the DSM-4. So he knows what he's talking about. And Dr. Francis is not anti-psychiatry. In fact, he's very much pro-psychiatry, but he believes that this field needs to be far more credible and accountable to be helpful.